of computational biology. She comes with a range of expertise, combining bioinformatics, machine learning, and her focus is really on cancer research discoveries. At the Institute, she leads a team of software engineers, infrastructure specialists, as well as bioinformaticians, where they are building tools that can empower and accelerate cancer research discoveries. I think what is quite unique and very exciting about Christina's role is that she has certainly been exposed and also led a range of big data projects, both at her previous place of employment and certainly affiliated to the National Cancer Institute. I think one thing that actually stuck with me is at her previous place of employment in Chicago, she was leading the National Cancer Institute Genomics Data Commons. And if you have been exposed to this at all, it's really this unified data system that will promote sharing of genomic and clinical data among researchers. In the context of the African continent, I think what we are very encouraged by is the experience that she brings from a number of platforms that she has worked on, where they have very close ties with their users. And one project, for example, which tends to support as much as 100,000 users per year. And so with that, I wish to introduce Christina Young. And Christina, I hand over to you as you share with us some of your ideas around enabling data sharing in public health. Thanks very much.
Thank you very much, Alan, for the introduction. Good day, everyone. It's really great to have this seminar and share some of my team's experience in building a data portal for the pandemic. And actually extending Alan's introduction, I have actually recently joined a company in Toronto. This is a nonprofit company called InDoc Research. I'm still affiliated with OICR to continue some of the work, but I would actually show you a little bit of what InDoc Research has been building in terms of data platform that also contributes to research in COVID-19. Okay, so starting off, just want to give you a sense of the case counts across Canada. So Canada is fairly widespread in terms of geography. So we are split into provinces and territories, and you can see a bit of case counts from the start of the pandemic to up till right now, with a lot of the cases, concentrated in the larger provinces such as Ontario and Quebec. So that's why you would see that more data would be contributed by these provinces. And as we go, we notice that Canada, this is the latest data from GSET, Canada has been gradually contributing data to GSET, sharing the genomes, but it's still a fairly low percentage. And primarily the issue is that it takes us quite a long time from having that data before depositing to GSET. And as you all know, time is very critical in this case when we're trying to track any variants of interest or variants of concern. Another issue we discovered, back a couple months ago, when we analyzed the data in GSET, our provinces are very diverse in submitting the metadata. In this particular case, the metadata we're interested in is the state of sample collection. And you will see that some of the provinces is actually missing that particular date information. And again, that makes it really hard to do any kind of tracking using this data. So as a result of, recognizing that we're not doing enough as a country to share our data internationally or even just within our own country, Genome Canada made a call to fund the development of a data portal. So some of the motivation, as I said, is we want to share data near real time, giving both researchers in Canada and in the world to be able to use this data. And we need to harmonize our metadata effort, otherwise it's not really great use of the data, and really rapid identification and tracking of the variants. So UK has been really a great example in their sequencing effort and in sharing the data. And of course, there were articles in journals, debating on, whether how the data should be shared in a way that the contributors are properly acknowledged. That's really important. And what we also recognize is while the research community in Canada is very accustomed to sharing data, building tools for big data, the researchers actually haven't interacted a lot with public health units. And they are the ones who are actually doing the sequencing and collection of the data. And so we need to bridge that gap of collaboration. So with these motivations, we formed a team, a really diverse team from across Canadian institutes, with Guillaume Bock being the leader, and other contributors from Simon Fraser as well. And also we have Jan Jolie, who is an ethicist and lawyer who really helped guide our policies in data sharing. And we also have Dine Stack performing the analytics that is downstream from the portal. So this is sort of the picture we drew at the very beginning. We know that we have the public health units forming the Canadian COVID-19 Genomics Network. They are the ones collecting the samples, doing the sequencing. And then after they have the data, we said, okay, where should they go, how it should be shared. And so we know that we want to have a VirusSeq data portal that is publicly accessible. So people don't have to log in to use the data. But that also means that the data needs to be non-sensitive. They cannot be direct identifiers. But the data that these public health units collect do have identifiers. And so the proper way is to send it to the Canadian National Microbiology Laboratory. They are well equipped and they are authorized to handle the sensitive data. They will actually got it into a state that will have no more sensitive data and then send it to the VirusSeq portal. And then from there, we can send it to other repositories as well. The model we talked about, maybe it has to be the other way around, whereas the public health send the data to VirusSeq and then VirusSeq send it back to NML. So as you can imagine, we put out this model and it was really out for discussion with all the provinces. Number one criteria is we don't want to add any additional burden to them. They're already very busy doing their work, handling the pandemic. We wanted to make it as easy as possible for these public health units to share the data. So we had some very high level requirements for this portal. Like I said, it has to host non-sensitive data. And thankfully, the Public Health Alliance for Genomic Epidemiology, PHAGE, had already put in so much effort in establishing the metadata standards. So by the time we came out to do this VirusSeq portal back in about March and April time, we already could adopt the standards very easily. And we knew that we were going to host consensus sequences at the beginning. And later we may host also raw sequences, but that is de-hosted. And we know this needs to be easy to use, right? You're going to have a wide range of researchers from genomics researchers, virologists, epidemiologists. We need to make this easy. So data upload seems to be fairly well established by other repositories using a web interface where you can drag and drop your files. Data search is something that our portal will really give strength to, because we notice a lot of these repositories, you can only download a big file with all the data. And then you have to sort of parse it using some programming skills to get the piece of data you want. And we think that we can solve that problem by having a web portal search. Data download needs to be easy, and we hear users saying that, oh, every time I download, it has to be everything or nothing. We want to make it incremental downloads so that people can say, hey, I only want the data from specific dates, for example. And we want to make this a real-time dashboard. Hopefully with no lag, at least from a technology standpoint, we want to accomplish that. And we really want to streamline this process for the public health units. Now, the challenge we got was that we're asked to build this portal in only 4 weeks. So it was a very stressful time, actually. A team of about 10 people worked on this, ranging from developers, mathematicians, to DevOps administrators. So we did manage to launch this on April 27th of this year. Well, how do we build this portal in 4 weeks? Because we've never done this before. Previously, if we build something in 4 weeks, it would be a prototype that would be thrown away. But this time, it has to be a production quality portal. So first of all, everyone was very motivated because we were really hoping to contribute to help out during this pandemic, and this was our opportunity. And the great thing is we do have a lot of experience in building data portals. I have worked with this team for 3 years, but really this team started many years ago by my predecessor, Vincent VGRAE. So he was the one who actually started the ICGC data portal, the GDC portal as well. And so we used some of our experience and also some of our software from these projects in order to build out the VirusSeq data portal. So some of our software is actually packaged in an open source suite. It's called Overture. This is a result of building multiple data portals and recognizing that there's some fundamental components that we'll need from one portal to another portal. So for example, authorization service. Even though VirusSeq portal doesn't require you to log in to download the data, it does require logging in to upload the data. So that component is critical. Downloading and uploading the data, we have a component called Score to handle that. And of course, handling metadata is very important. So we have another component to handle it. And in order to make the data immediately available in the portal and is searchable, we use indexing service. So we actually index the data into Elasticsearch, and then we have the APIs and the portal UI in order to support the search. So the basic components were right there. We use third-party technologies as well, such as Elasticsearch and also Kafka, which is a messaging mechanism. So we know that when data is coming, has just arrived, and we action on it. So this is completely open source, so feel free to check it out. You may be able to adopt some of the components for your own project, and we are happy to help you. We're actually on Slack to help some of our users in the setup. The other very important component is infrastructure. So obviously, this needs to be set up on some kind of compute infrastructure. We already have a cloud operating in Toronto. This is actually our own compute cloud, so we have a lot of liberties and control over what to do. And very importantly, we already have routine backup and system monitoring, those kind of tools that we need in order to support a production portal. So again, this is very important infrastructure to get us going immediately. So you think, okay, it's just another data portals, and we thought so too. But then when we actually got into the details, we realized there's some major differences supporting a virus genome portal versus one for cancer genomes. So cancer genomes is something that we've been very accustomed to. We can handle that. And I just want to point out some major differences. First of all, With the virus genomes, the metadata is a lot simpler. That's good news. With the standard by phage, we can easily handle a lot of metadata in a single tab-delimited file. That's great. It's easy to validate. But when it comes to genomes, in cancer, we typically only see maybe hundreds to thousands of genomes per year. It takes time to collect the sample. It also takes time to sequence it. It takes time to transfer. So we don't see a lot of genomes per year, but also the genome itself is a lot bigger. So our system was built to handle a small number of genomes, but each in a very large file size. Now, with virus genomes, that's the opposite. You get tens of thousands of genomes in a very short period of time, but each of them is very small. So our system actually needs to be adjusted to handle that kind of load is different. So the data transfer itself is also different. Now, when you take just seconds to accept 10,000 genomes, the system needs to be able to process one by one in order to get it registered into the system. So we need to adjust for that as well. Another major difference with the download is with the cancer genomes, we always just package the individual files into one package for download. We don't actually have to open up the file itself and do anything. But it's very different with the virus genomes because we want to package multiple genomes into a single file, a single FASTA. So that actually requires us to write to the content in real time. And so again, we don't have the services to be able to do that. So we have to build that out. And again, when it comes to data release, we want the real-time data for the virus genomes. That wasn't the case with cancer genomes, especially with research genomes. In the cancer domain, people are happy with a release maybe every 3 months or so. So we were able to do that in the cancer genomes, but not so much in the virus. And of course, with the virus genomes, we also need to perform a web interface to allow the upload and download as well. So definitely some new services we had to develop to support the VirusSeq portal. And this is a very high-level graphics to describe how we built this. We have some components from our existing Overture modules to handle some of the components I've already mentioned. We use third-party technology as well. But here are two specific services we build, which is the upload and download services for VirusSeq because of the difference the virus genomes are when it compared to genomics. And here's our GitHub repositories for the open source code if you're interested. So these are the standard APIs we use to support the upload. And so, like I said, the automated data release is definitely a challenge. And we didn't get to this feature until after the launch because we couldn't develop this in 1 month. But basically with this system, users are allowed to submit to data any time of the day. We don't have anyone sitting there and curate the data. As soon as the data is submitted, the system will ingest it, and now it becomes available in the portal. I'll actually show you a demo of it. Now, to make that data immediately available is easy part, but we also want to put a timestamp on that data. So there's an actual release archive so people can, especially when they're writing their papers, they can point to a specific release of the data so others can and repeat the analysis if they wish. So again, this is the API service called Singularity that we developed and is of interest to anyone who's more technical in the technical implementation. So now I'm just going to go to do a bit of demo of the portal so you get some flavor, because I can see that someone asked, oh, what is the difference from GSET? So I'm going to go to this portal. Now, as you see, the number here is actually a lot smaller than the production portal because I'm currently in a development environment because I want to submit some data to this development environment without polluting the production data. So as you can see, this is our landing page. And if you go to the exploration page, you can see there the search functionalities on the left. I don't believe GSET gives you this functionality. You can search by a range of metadata that was submitted by age, by gender, purpose of sequencing, etc. And this table kind of summarizes your search results. Here is the data release page that I mentioned. So anytime that when data is submitted, a release archive is created. So you see there are 738 samples created yesterday. And this is real time. So I'm going to show you how exactly this happens. So for me to submit the data, I come in, you see at the bottom, there's submitter login. So I can log into the portal. Okay, and this is the submission dashboard. So here on the left, these are the submissions I've done in the past, so that I can see a history of it. And here, there's some very simple submission instructions. They're more detailed information at some of the link outs. But here, all I have to do is select upload files. And I've already created 2 files. One is a FASTA file with 20 samples. And here there is a TSV with the metadata. So the TSV, we're following the phage standard. So it's fairly simple to do. And all I have to do is upload these 2 files. You see that they're here. And when I press submit data, the system will validate the metadata. Oops, so maybe this is not a good submission. Study service. Okay, so let me try another one. Okay, so this one went through, it basically validated the metadata. So the previous example showed you that my metadata was bad, so it was rejecting it. And now this one with the good metadata, you can see in real time that it went from queued, processing to complete. So I've added 20 genomes. So now if I go back to the portal to look at it, previously I have 738 files. Now it has added 20. Now, of course, you notice the genomes hasn't changed because actually I'm using the same samples, but uploaded multiple times. And so the system does recognize the unique identifiers of these samples. Now, if I go to this data release page, if I refresh this, it's taking a minute to build it because what happens is the system will sense whether the data is continued to be updating. If there's no more updates, then it builds the package. So there it is, 7:26 Toronto time. It added just 20 samples, and now this becomes an archive that can be downloaded by any researchers. So this is something that is fairly new to any portals that we've built. We've never had that before. Now, let me go to the production portal so you can see some real data. So this is our production portal via seek-dataportal.ca. You can check it out and play with it. We now have 72,000 samples uploaded to the portal. Now, when you come here, obviously, if you go to data release, now you can actually download the data. Maybe you want older archive, that's possible. But one of the features that really stands out for users is that you can select specific data sets using the search criteria. So I'm going to try something here. So for example, I'm only interested in sequence submitted by the Saskatchewan lab. I choose something that's small, so it's 18 samples. So when I click this, you will see that the search results change. It only gives me the 18 files. The results now in the table. I can actually choose additional columns to view. There are a lot of metadata, but by default, it doesn't show all of them, but you can see additional columns. But the key thing is I can do a download data set. And in this case, only the 18 genomes matching the search criteria will be downloaded. And so in real time, the system will package these 18 virus genomes into one package. And this package will have both the FASTA and the TSV as metadata. So this is definitely features that portals like GSAT doesn't have. So we hope to make it easier for others. Okay, so this is a short demo, but please play with the portal and please give us feedback. We always would love to hear from users so we can make your research easier. Now, going back to the presentation, I just want to give you a sense of the submission of timeline. So we did launch back in April, and we launched with only over 100 samples. And it really took a long time for the public health units to buy in. We had several meetings with the provinces to explain to them what the portal is about. We engaged them, we worked with them to establish an acknowledgement policy. We worked with the National Microbiology Lab on the process of submitting data. So finally, all that work pays off. And so starting in August, we start to see this data trickling in. And also, of course, it takes time for them to understand, how to format the data, establish that data processing pipeline. Now that the process pipeline is gradually maturing, we do hope that the data will continue to come in. And so just looking at, the time info between the date of the sample being collected to the date being submitted, we see that some groups have been working more on that backlog data. So there's a larger gap. There are older data that is being submitted, maybe even from more than a year ago. But we start to see with the recent data that there are submitted, after only maybe 20, 25 days of being collected. So we're getting the process down and we're getting the buy-in from the provinces. So we do hope to see more real-time data now that the portal is available to them. And as I said, it took time to establish that data processing flow. We now got it down. The public health units are sending the data to NML, then sending the data to the data portal. And the data portal does have a curation team to help with the submission process. And that curation team is running out of Simon Fraser. So just want to go back and we talked about this flow. But what is really happening within the province itself? And it really differs from province to province. I can give you a little glimpse of what's happening in Ontario, because now that at my new position within DOC, we're actually helping the Ontario Public Health Unit to get some of the data analyzed. So with the Public Health Ontario, they have actually 4 other labs to do the sequencing. And the number of genomes they sequence is fairly fixed in terms of absolute number. So the percentage of samples they sequence really depends on the case count. When the case count was high, they only sequenced about 10%. But later in May, that was increased to 50% and even up to 100% in mid-June. Now that we're in the 4th wave, with some cases increasing, so we now are sequencing about 50%. Now you can imagine PHO with 4 labs sequencing the data, they really need a secure compute environment to share the data among themselves, because the data they have does have direct identifiers on the patients. They need this compute environment in order for all the labs to upload both the sequencing data and the metadata. And then after the data is available, they need to perform analysis. So running things like pangolin, NICstring, and then generating these reports to share with public. And eventually the data can be exported to the NML for further processing and submission to other repositories, including VirusSeq. And then lastly, in addition to this analysis of lineages, they do want to do further analysis, including vaccine status, any travel information or outbreak information. This is all provided by the Ministry of Health of Ontario. So now we're linking different data sets together for analysis. So in order to do this, the platform that is being built, it's a bit of a long name, Viral Genome Repository and Analytics Environment. But basically all the labs send this data into the secure environment. We quality check the data, and then there's the analysis workspace in order to perform the analysis. And finally, the data got exported out to public health. And this is a secure environment that is strongly warded off. There needs to be logged in with two-factor authorization. And anything that is happening there is strictly monitored and audited. And so this is another difference of the environment. It's very secure, we'll be able to handle sensitive data. Now, for Ontario, not only are we handling the genomics data from the virus, but we also want to do other studies related to COVID-19. So there's a new platform being developed. It's called the Ontario Health Data Platform. And this one, it has clinical and administrative health data. So it's not genomics data, but it's really a wide range of clinical data related to COVID-19 patients. There are prescription drugs data, there are ambulatory and critical care, any outbreak data, and also there is even data about mental health services, and some of them were pre-registered, and we want to know how their care has been affected during the pandemic. So in this environment, there's also high-performance computing available. Compute power is right there. So researchers can help answer some of these critical questions in health research. Understanding the disease, the transmission, there's also disease management. And also another thing we want to look at is actually health equity. How does this pandemic affect people who are already vulnerable before the pandemic? And how can we improve this healthcare in the future as we get into situations similar to this? So this platform is also available for COVID-related research. And some of the lessons learned in this whole effort of building the platform they're definitely a lot. I can't really be naming all of them. But one thing I put on top is resilience. And I'm not just talking about our ability to build a portal in a very short time, but all around the world, we are all very resilient. We apply our knowledge, whether it's from building something for cancer, doing vaccines and all that, we build solutions using our knowledge, all in record times and in this very unprecedented times. So I think all around we really should, pat ourselves on the back. I'm really doing a great job despite, some very challenging times. And from a technical perspective, I would say that developing a technical solution is challenging, but relative to many things, it's easier. As I show you, once we have the portal, it actually took a long time before we actually have the data coming into the portal. And I think socializing the idea of sharing data is actually took a lot more effort. Obviously involves developing a lot of processes and policies, the engagement, the buy-in, ensuring that all the stakeholders that will handle the data responsibly, especially when it comes to data privacies, and also giving proper acknowledgements for researchers' contribution. That's all very important things to establish and to get agreement and consensus. Now, after all this effort of establishing these collaborations and these processes, the policies, what can we do? How can we leverage these efforts to improve our healthcare in the long term? So in the case of the Ontario Health Data Platform, it was built specifically for COVID-19 research in response to the pandemic. But we're now starting to think, well, can this actually be used for long-term research in order to improve our healthcare policies, improve the way that we treat patients, maybe be more cost effective. So those are the things that we're thinking about. And of course, if there is another pandemic or there are other critical moments that we'll be more ready to get into action based on the lessons we have learned during this time. So with that, I would like to acknowledge a couple of teams. So this is the OICR team who built the VirusSeq portal and many of the wonderful software. And this is the InDoc team that I joined recently that is building the Ontario Health Data Platform and the virus analytics environment as well. And lastly, all these projects are funded generously by Genome Canada and also the Ontario government as well. So with that, I'd like to thank you all for your attention. It has been my pleasure.
Christina, thank you very much. That was certainly, to quote one of the participants, an inspiring presentation. Looking at the questions, we've got 2 questions in the Q&A. Maybe we could start with that. And the first question comes from Heath Robertson, and it's around, can you or do you know the number of sequences that were generated in Canada that has been submitted to VirusSeq versus the comparable amount that has been submitted to GISAID?
Right. So here is the latest from GSAID I got. We have shared over 100,000 genomes in GSAID. It's definitely a low number. So in the VirusSeq portal, we are just seeing about 72,000. I'm not sure about the overlap. I'm sure there is overlap. I don't know the quantity, but it's really in our hope to share more in both portals. It's really important.
Yeah, and I suppose the one point that you were raising is that it's providing this enabling environment that will allow the data generators, in fact, to have the space with which to engage across provinces, possibly, so that the end result of submission to an international repository becomes one component of what they are trying to do in order to respond to COVID-19.
Right. And I would say there's definitely synergy, because once the data is in VirusSeq, the labs have said that it becomes very trivial to submit to GSAID. It's not a labor intensive at all. So there's definitely motivation to, hey, get this last step done as well.
Maybe what I'll do is I will take the next question before I come back to maybe talking a bit about the stakeholder engagement. So there's a question from Matteo Galeas, and he thanks you for an inspiring presentation. And the question really is around, how do you envisage this portal that could deal with institutions located in different countries with different data protection regulations? And as you answer that, could you maybe also just reflect on your experience with the interprovincial management of this platform?
Right. So with the VirusSeq platform, because it's non-sensitive data, it was much easier to ask the province to submit to a centralized location. There was no controversy. But obviously, when the data becomes sensitive, the provinces would want to host the data in their own province. They don't want to move it. And this is not new. because in our other project called the International Cancer Genome Consortium, now that's cancer genomes from around the world. And as you know, human genomes by itself is identifiable. So there are definitely jurisdictions and regulations saying that, nope, the data has to be hosted within their home country. It cannot be sent elsewhere. So we're experienced in building data portals for that. What we do is we build the storage system within that country. So all the genomes are stored there. But the metadata itself, which is non-sensitive, can be submitted to a centralized location. So we build the portal with the metadata that allows searches. So you can get search for data from this project. You don't even know where it's hosted. Once you find the data, now we provide you the tools so that you can actually download the data from that particular repository hosted in a different country. So we allow the distributed storage of the data, but a centralized search of the metadata.
Thanks very much. And I think this is probably the one thing when one just starts to reflect on the mandate at the Africa CDC and our role in engaging member states and really thinking through the development of pathogen genomics policy frameworks, which unfortunately, sometimes these things happen in the context of a pandemic. And so it's pretty much during a crisis mode. And so it's interesting that the time taken by your team to engage a range of stakeholders in order to get buy-in on the VGRAE portal, and how that one has to factor that in. But linked to that, there was actually a question from somebody, and it is Foster who asks, you talked about how long it took to get the buy-in from public health groups. So now that you have achieved that, can you talk about some of the ways communities might be using the data or influencing community-based action versus the higher level researchers? So looking how does that data get used for community engagement versus some of the research intensive work that people are carrying out?
Right. So with the KangoGen network, they do have analytics working group, and this working group definitely wants to perform downstream analytics to find, for example, variant of interest, variant of concern. It's still very research based and influencing community-based actions. That's an interesting one because community-based, so far, governments have been, educating us to get vaccinated. And that information is not part of the portal. And I don't know if, I'm just thinking on top of my head, if including vaccine status that comes with these samples may actually be interesting because people would see that people who tested positive or had the cases were largely unvaccinated, then that might be an incentive.
Yes, indeed. And I think that probably would lead me to, a question around, we do know that, as more and more genome data is being produced, we're obviously getting into a space where one is wanting to understand the impact of that virus on the host. And also then one gets into more research-based projects around mechanism of action and mechanism of how infection happens. And so I saw you've mentioned the new project which you have embarked on, this health data platform. And so in that, the scope of that work, do you see the crosstalk between what you are building there and allowing investigators to tap into or to integrate with the pathogen data, which is visible through the VGRAE portal?
Sorry, you break up there with your questions.
Oh, sorry. Yeah, no, I was just asking, with your new project around host data, the human data platform, do you see a crosstalk between what you're developing there and the ability to integrate with information sitting in the VGRAE portal as one tries to understand some of the host pathogen interactions?
Yes, definitely. So we have already discussion, for example, long COVID is something that will warrant research in the coming, months and maybe years. And so having some of the information, so the Ontario Health Data Platform is hosting some of the clinical outcomes of the patients. So for example, how long they stayed in the hospital, were they on ventilators, after their discharge, are they on specific drugs? And then so that will be interesting to link it back to the virus genomes, but also the host genomes as well. So another project supported by Genome Canada is actually sequencing the host genomes that has been contracted COVID-19. So putting that all together, linking together, would be very interesting for research and hopefully finding, a solution or relief for some of the COVID-19 patients.
Absolutely. Maybe let's just quickly go and look at some of the questions. And apology if I'm missing some of your questions. There's a question from Joseph, and Joseph is asking around the technical capabilities of the underlying code of the VGRAE platform to manage federated users. And so this one could be tied into the earlier question around, would it be possible to share and engage with people in different geographical locations?
Yep. So we definitely have solved this problem of authorizing researchers from different locations, and we can even give it finer grain. So we can define what a researcher can access. So for example, it's very common to have data under embargo for a period of time. And so we can definitely configure such that researchers who share their data may get access to only their data. Researchers who share the data get absolute private access to the data for a period of time before it opens out to an additional group of users. So we can have that kind of control to motivate people to share data, especially if you are working with, groups around the world. You need some way to share that data while working on your paper, and this will be a mechanism for that.
Oh, yes, indeed. There's another question, and it might be, and I'm not sure if it would be more appropriate to hand this over to Gizaid rather. And there is a question from Anasia asking around the requirements for sharing data at Gizaid.
I'm not aware of specific requirements. I know you do have to get an account, and I'm not tried uploading data, so I don't know. I do know as a user, there definitely a data use agreement when you use the data.
I think that is fair enough. Could I maybe then ask you, looking at the users of your platform and people who are wanting to adopt or extend your code base, do you have examples whereby which people are using your platform or possibly the framework in order to apply it to a non-SARS-CoV-2 example? And I'm particularly thinking of what we're driving at the Africa CDC is building the capability in order to respond to disease outbreaks beyond SARS-CoV-2 or COVID-19.
Yes, so definitely we do have collaborators in Europe, setting this up for this kind of portal just using our out-of-the-box components to support their own internal project. So what I've shown you are components that we built together, but we do have a version of the software that is really easy to set up. I managed to do it without my developers' help. And so that may give you a flavor to set up one instance in your particular domain. And then another instance can be set up in a different location. And the good thing is they can actually talk to each other. So the model we're using is that you set up different instances hosting the data, but you have one centralized portal so that you can actually view the data more easily.
All right, and so your dashboard allows you then to essentially monitor a variety of sites and also have a good handle as to how data is being submitted and also various checks that needs to be done.
Yeah.
All right. There's a question that has come through from James, and it's related to an earlier question by Foster. And so the question is, as a developer and a higher level scientist, borrowing from the phrase used in the other question by Foster, how do you ensure that your interests also take in the interests of public health officials who might have a much more simple and specific reason?
Right. So we definitely want to build something that is usable by a range of users. So I would say in the normal development phase, we actually get a lot of use cases and do sort of interviews with the potential users. In this particular case, we did a lot of guesses, I have to say, at the beginning, because the requirements weren't there. So we just think about how public health can potentially benefit from this data. But I do agree, I would love to engage more with them because I want to build something that is not just used for this period of time, but for some other future times where public health can use it as well as researchers. I do recognize the needs are quite different from the two groups. And maybe it's not about one portal serving both groups, but two portals serving two groups, but possibly with underlying the same data. It's about how you ask the questions on the data.
And I think it's interesting I think even just with the example on the African continent, the Africa CDC had probably about 12 to 13 months of workshops with public health implementation scientists and bioinformatics experts in trying to understand the needs of national public health laboratories and really trying to ascertain what are the requirements within country, and then also what are the barriers that would facilitate both easier sharing, but also maximizing the utility of the data that's being produced. And so I think what I'm really taking home from your talk is the need for a technical solution to be taking place in parallel with extensive stakeholder engagement so that there is sufficient buy-in and ownership of what eventually gets produced as a dual development project.
Yes, I think use cases are where we start off with. I really strongly encourage getting use cases, having that understanding of how the data will be used, what questions will be asked against the data, really drives our development. It also motivates us knowing that this is going to be useful to somebody in the end and it's going to make an impact.
Absolutely. And I think we haven't really touched much on, just what type of resource provisioning, but even just looking at the teams that you have acknowledged, it is clear that there is a wealth of expertise that underlie much of the successes that you guys have had. And so I think that is something for us to also take into account.
Yeah, so that's another piece that I would be interested in, is actually sharing that knowledge. My team has always been very open in terms of sharing knowledge. That's why everything's open source. And so if we can collaborate in a way that we help you build something and share that experience and that knowledge, I think that would be very beneficial for everyone.
And so maybe as we actually approaching the hour, maybe just to remind people that we have a link that has been provided by Christina in the chat. And so you can certainly take a look at the documentation of Overture. And I am certain that we will have much more engagement with your team, Christina, as we start to think through how do we strengthen, certainly in our case, the continent in responding to disease outbreaks far beyond what we're currently encountering with COVID-19. So with that, Christina, let me just use the opportunity to thank you for your time. Thank you for sharing some of your experiences and just looking at the responses from people on the chat. I think many have certainly enjoyed some of the insights gained from your and your team's approach to responding to this current need. And to the audience, I'd like to thank you for your participation. Through the Africa CDC, we will certainly make the webinars available to you, and I think you can certainly keep a lookout for further communication as we further strengthen the continent with the range of talks that we have lined up leading through to December. Thank you very much, everyone. With that, we are going to close the webinar. I see that all the questions have been answered and many people have been saying their thanks. So Christina, thank you very much for your time.
Well, thank you everyone for having me. It's been a pleasure.
All right. Thanks so much. Bye.
Bye now.